Thank you, Dr. Rishi. It's indeed a pleasure to be part of this course again. I'll be talking on meibomian gland dysfunction, a missed entity. Look at this 43-year-old female who was suffering with red eye irritation since 2 years and had taken around 8 ophthalmologist opinion in the last 2 years. And eventually the diagnosis came out to be acne rosacea. Taking the patient on slit lamp, we immediately noticed there's an element of dry eye. The meibomian glands were plugged and obstructed, and that telangiectatic vessels on the posterior lid margin. Now, this untreated MGD, this was obviously a case of meibomian gland dysfunction. Untreated MGD eventually leads to or promotes evaporative dry eye, chronic discomfort with ocular surface damage. Now, this is what the normal meibum looks like. It's clear and small droplet of fluid, oily fluid that we notice. And they can be graded into grade 1, 2, 3, 4, which is a clear secretion that you see on the first slide on your left. It can be a cloudy secretion, which is grade 1, and it can be a cloudy with debris involved, which is grade 2, and grade 3 would be this toothpaste-like excretions that we see. Now, the eyelid margin features in meibomian gland dysfunctions would be thickening of the lid margins, as we see over here. The lid margins might be vascularized. There might be rounding off of the sharp posterior lid margin with hyperkeratization of the meibomian gland openings, and there might be lid margin telangiectasias. Lid margin changes might include posterior lid notches that you can see over here very clearly. There can be dimpling of the posterior lid margins, which is due to tissue absorption based on long-standing post-inflammatory changes. Advanced meibomian gland dysfunction will present with anterior migration of the mucocutaneous junction. There might be epithelial ridging due to mucosal absorption. There might be retroplacement of the meibomian gland orifices, though this is most commonly seen in advanced cicatrization form of meibomian gland dysfunction. Associated lid features will include anterior blepharitis, eyelid, eyelash loss or malposition, or Demodex anterior blepharitis, as talked about previous speakers with cylindrical dandruff. Now, one of the investigative tools which uses infrared photographic method for documentation of meibomian gland functionality or presence is the meibography. You can see these meibography, you can clearly see these grape-like clusters, ducts and orifices are hyperluminescent, whereas acini are hypoilluminescent. You can clearly see on the slide on your right is that you can see a large area of meibomian gland dropout, which is suggestive of an advanced stage of the disease. And remember, once these glands go into the dropout stage, they can't be brought back. Lipid tear film interferometry is another tool, though not easily accessible to all. Clearly tells us the meibomian gland functionality, because eventually this lipid layer is the secretion of the meibomian glands, and altered meibum as well as decreased meibum will cause thinning of this lipid layer, causing evaporative dry eye. Now, what are the treatment options that the patient has? Warm compress stays as the mainstay of treatment. Warm compress along with mechanical lid massage and eyelid hygiene. There are various methods to do that. I don't have the luxury of time to go into the detail of each. One of the sophisticated ways would be to would be what LipiFlow does, which is the mechanical pressure along with thermal pulsations, which give a very good massage and opening up of meibomian gland function. Tear film, artificial lubricants are very commonly used in meibomian gland dysfunction, which not only takes care of the dry eye, underlying dry eye, but also dilutes the toxin and debris, and also the pro-inflammatory stimulus that comes along with it. Phospholipid supplementation or lipid supplementation to the tear film is pretty important, but it's unfortunately not available rampantly all across. But here you can see a video where there's phospholipid. Go back. Phospholipid spray being used here. It actually melts down and goes to the lid margin and then goes into the tear film. Azithromycin 1% drops are used very frequently and in fact recommended in the treatment of meibomian gland dysfunction. This not only acts as an anti-infective, but most importantly, it acts as an immunomodulator and anti-inflammatory agent, important in the treatment of meibomian gland dysfunction. Oral doxycycline or minocycline, 100 milligrams twice a day in case of doxy and 100 milligrams once a day in case of minocycline, can be used for around 2 months in meibomian gland dysfunction. Forced meibum expression is something that has been used for more than 80 years as an in-office procedure. And you can see here using pedal and a pressure from a thumb, you can easily express out these toothpaste-like secretions. Intraductal probing has been one of the things that are being tried down. This is a video by Steve Maskin from Tampa, Florida, where he uses a 100 microns thick probe, 1 to 6 millimeters long, and he probes these duct orifices. And he claims to have a good success rate on the short-term period. Supplementation of diet with omega-3 fatty acids has also been considered in management of meibomian gland dysfunctions, but one good advice to our patients would be to avoid omega-6 rich foods like red meat. One thing that's been enunciated by the previous speakers is about Demodex infection. This actually coexists, especially in the elderly, with meibomian gland dysfunction. It can be easily diagnosed by plucking out one of these lashes with cylindrical dandruff to look under a light microscope, and you can easily find these worms moving around. Use of 50% tea tree oil, weekly lid margin scrubs also involve the eyebrows where you clean it with tea tree oil, also helps in such cases. So MGD perhaps is the most underappreciated disease, underdiagnosed disease, undertreated disease in the eye care worldwide. I guess we just have to use our finger, put some pressure on the lids, and we can see these expressions, and we immediately can diagnose these cases. Thank you. Thank you very much.